Okay, let's go ahead and start. We have a lot of information to cover today. I have screens going in all directions, and my counterparts here at the Department of Mental Health are all over the building. So I'm going to ask that for the sake of keeping down distraction and certainly making sure that we don't get information distorted in any way, just going to ask that all of you, besides the ADMH people who will be presenting as a part of this conference, please go ahead and jump off video. You can certainly keep your
come up here if you're not afraid.
bodies mute yourselves on your end for me, please, so that we can minimize distraction. We want to be sure that the information we present is very clear and free of distortions as much as we can to that effect. So I'm going to ask if you will please go ahead and jump off of video for now. You can drop your names in chat if you wish, just so that we keep a record of those who are here. I would appreciate that. I'm going to ask again that you stay on mute for me, and I'll ask my ADMH folks here to help me watch that. And if you see something that could be a little bit distracting, do just go ahead and private message those who are participating to let them know we need to take some action to prevent that as much as we can. Welcome everybody. We're glad you're here, and this is a first for us. So this is something new we are trying. We hope this will make the process a little bit better than it's been in the past. It's a little different from some of our normal RFP processes. So with that being said, I want to give us just a few guardrails to follow and to kind of everybody adhere to. Again, if you are on video, I'm going to ask if you can turn that off. That will help, again, just to minimize the distractions for others in the conference. So we are looking, we want to certainly stay in place today and at a pace that can get you the information that you need. I'm going to ask that you hold all questions for anything that we say until the very end. There is an opportunity at the end for you to ask questions. Any questions we don't have the answers to, we're going to give you guidance on how to go about getting those questions answered beyond today. And again, just hold those questions for us. We're going to hit the high points today. We're going to do a quick run through of just all those important things that you need to know and things you need to be aware of. We're going to offer some time again just to clarify some of the things that we learned from the previous lessons of having done this RFP in the first round. So hopefully some of what this will do today is help prevent some of those same conflicts that we ran into last time. This is not a time, I just want to say something quickly before we move on. This is not a time for us to hear your program idea descriptions and for you to ask us to comment as to, yes, we can fund, no, we can't fund. That's not the purpose of it. So I am going to ask that you are quick to kind of field those questions, recognizing that that is not something once an RFP is published that we can do. We cannot guarantee an award will be given for the description you are interested in proposing. So your questions need to refrain from that. We do want to, give you as many guidelines as we can, but and answer as many questions as we can. But we can't make a promissory comment as to what we will fund. And again, we want to save plenty of time at the end for questions and answers. I'm going to quickly run through just some other slides here for you. This is where the RFPs are located. I have gotten numerous phone calls and emails saying, can't find it, went to the website, don't know where to look. Well, there it is. Hopefully, all of you have downloaded that already and have access to these 3 RFPs that have been published. So it's actually listed under the contracts and purchasing tab of our website. And then you can go and actually download a hard copy, a PDF of that, so that you can use it for your references in writing your RFPs. For those of you who might have joined us late, I'm going to ask you to turn off your videos for us unless you are from ADMH and presenting during this presentation. That's to help minimize the distractions when we can. Please do keep your phones on mute. All right, so that's the information that you need to access the copies of the RFPs. Here are some general guidelines. These are the same general guidelines for all three of the RFPs that have been published for the use of these funds that have been allocated to ADMH this last session for the use of opioid settlement funds. The guidelines are important, very important, and you're expected to follow those implicitly. So please pay attention to every detail, not just your timelines, but the details of each RFP, including things like your cover sheets, your application content, the order of it, your budgets, the program descriptions. And please keep in mind that those program descriptions are separate and unique for your original RFPs and those that you are, that those of you who might be applying for continuation funding. Okay, someone's got some background noise. I'm going to need you to stop that for me. I'm trying to see if I can figure out where that is, but it is creating some distortion. Okay. So make sure that you that you pay attention to whether or not you are making an original request for this is true to these RFPs, or if you're doing a continuation request. But those program descriptions will look different. Okay. Anything on that? And I'm going to ask my counterparts here at ADMH if you hear something that. Okay, funding limits. Let's talk, or excuse me, a review of the funding. Let's talk about that for just a second. So I'm going to invite Mark and Brooke and Denise and Brandon to actually address this. One of the things that we discovered in the last proposal opportunity was that people were often confused as to what category they should apply for. Some people got confused between prevention and recovery support services. So this is just a brief, we're going to get into a little bit more detail, but I wanted each of them to go ahead and address the funding allocations. And in another slide, we'll have them describe the descriptions for each of their programs. So Denise, do you or Brooke want to speak up to your funding allocation for the, wait, I'll go ahead and do treatment recovery. Sorry. Brooke, do you want to do that one or you want me to?
I can do it. I did want to comment. It looks like an iPhone. I'm seeing an iPhone. It looks like that one might be the one creating some background noise that might not be on mute.
Thank you. I appreciate that. Let's see if we can identify that. Go ahead, if you will, and just describe the allocation for treatment recovery, please.
Of course. Okay, so for treatment and recovery support services, of the total funding allocated by the legislator for treatment and recovery support grants in this 2024 opioid settlement funding round, the total designated for treatment services is $5.6 million or $5,600,000, and the designated amount for recovery support is $800,000. So that's treatment and recovery support services.
Great, thank you, Denise. Can you speak to the residential one for me, please?
Sure, I can, if I can find where the mute button was. All right, so yeah, we're going to do one particular RFP for withdrawal management. And just so that you'll know, we're just trying to line up the language with what SAMHSA is introducing currently. So you may have seen detox in the past. We're trying to change that language over to withdrawal management. That award grant is in the sum of $1 million. And it is for just the residential detox program. This is the only RFP that you have to be a certified provider for at least 2 years in order to apply for this one. So this one is just a little bit different than the other two, but just remember that. But it's for the total sum of $1 million.
And that is for one award, correct, Denise?
That is correct. We're only giving one award in this category.
Okay, thank you.
You're
Brandon,
welcome.
can you speak to prevention quickly, please?
Sure. Prevention for this particular RFP, the total is $2,749,200. And agencies are able to apply for up to $75,000 for funds for this particular RFP award. And also the difference between the previous and this RFP. This RFP allows for providers to address a polysubstance. So opioids would be the primary, is along with a secondary substance can be addressed with this RFP.
Awesome, thank you. All right, let's move along. Our next slide is going to address the funding limits for each award. Again, it's kind of already been stated, but let's just, again, directors, if y'all see anything there, we need to say an additional to that. It's the treatment and recovery support. These are maximum award amounts to be awarded per award. This is not the entire limit, as we just reviewed in the previous slide. These are per award. And let me just leave that open then for any of the directors to comment too. So this is definitely a change from last time. For those of you who may have looked at the RFPs in the first round, we did not set an award limit. That was one of our lessons learned. So we had some agencies wanting the whole 8 point whatever million it was, and others that wanted a few thousand. And so we felt like this would clarify and give everybody a broader scope of how then the money could be requested, or how the funding could be requested. So these are the maximum funding allowances that you will be permitted to request in each of your proposals. You may apply for, you may submit multiple proposals. I will go ahead and kind of throw this bit in here. I think I may have it somewhere else too, but that's okay. You can, except for the withdrawal management, you can submit multiple proposals, but not for the same services in the same location, same population. So for example, if you are requesting for residential beds and you want $350,000 for a program that you are setting up in Somerville, and you are going to serve women, and then you submit a separate $350,000 request for residential beds for males in the same location, same building, same program, same budget kinds of accommodations as the other, that likely is not going to be awarded because those are basically same location, same program. So consider that when you're looking at the variables of what you're wanting to do in multiple applications and multiple proposals. Okay, let's move ahead. So just quickly, here is just a rundown of who can and who cannot apply. Obviously, current certified providers are eligible as long as you're in good standing. I'm not going to take a lot of time to describe that because you know who you are. If you are under a provisional status or have been on a probationary status, there are probationary, I think, would likely make you excluded. I think Beth can probably address that for us in a little bit, but you have to be in good standing. Again, as Denise mentioned earlier, for your withdrawal management RFP, you have to have been a certified provider for a minimum of 2 years. Okay. Other providers, there will be some, you're eligible to apply. You do have to meet certification eligibility within 4 months of the award. The date of the, for those who are awarded, the date that you receive the letter from ADMH stating that you have been awarded, for those who are selected, it will begin the date of that letter. So it's real important for you to pay attention to that. So there are guidelines in the RFP. Again, that's what you need to refer to. That's what you need to follow. Previously awarded awardees with the opioid settlement funds that we ran on the first round, there's some language in the RFP for continuation awards, and your proposals look completely different. Your budget's going to look different. The requirements are different. There's some questions that you've got to be able to respond to from the previous evaluation. So all of that's going to look just a little bit different, but we are making an allowance for a continuation funding this round. So just keep in mind that may not always be the case, but we are allowing for the application for continuation. And you do have to read the guidelines for that and be very clear as to what it is you're requesting with that. And there's the criteria there as well for those who may not apply. If you have received, your entity or organization, if you have received opiate settlement funds as a result of the litigation process that's been a part of state suits or any of those that are in conjunction with the pharmaceutical companies and local municipalities, you may not apply. You are ineligible for these grants. Okay. All right, continuation funding, just want to hit on this again. Again, this is specifically to those who were previously awarded the opioid settlement funds grants in the first round earlier this year and are interested in continuation funding. In general, you have to provide established documented outcomes for the use of the previously awarded funds in that first round. And then you have to complete the evaluation process for the initial award. You have to show measurable outcomes for the continuation, as well as documentation from that on the first round, and you have to answer the required questions that are outlined in the RFP. Agencies can submit the multiple proposals, as I mentioned, but not for the same services, same location. Those are for the new applications. But these are the guidelines for the continuation funding. And also, look, again, I just have to refer you back to that RFP and all the language that's there for you. All right, Beth, this is all you.
Okay, good afternoon, everybody. Just a quick update on provider certification information. I'm Beth Bergeron, Director of Certification for Mental Health and Substance Use. Just to introduce myself, agencies who are not currently certified as an ADMH SU provider must complete a two-phase Becoming a Community Provider orientation in order to be eligible to make application to become an ADMH SU provider. And we provided the link to the website where you can find that information. Just a brief, phase 1 is an online course and it can be taken anytime, but must be completed prior to you completing phase 2. Phase 2 is a live webinar and these are offered several times a year. And just for your information only, not saying you have to participate in this one, but just letting you know ahead of time, if you voluntarily decide you may participate in the one that's coming up in October. There will be additional ones possibly this year. So again, you can participate in that one in October if you're not currently certified, or you can wait to participate in the next one when we offer it for this purpose. Again, the next one is the end of October and all the information can be found at the link. Again, I can't stress enough, the one in October is up to you. You don't have to, but if you choose to, that is entirely up to you. In the interim, if you're just curious and because you're not currently certified, for substance use providers, we do have 2 administrative codes. That information is also provided at the link that we provided. But if you just want to take a note, I know I throw out these numbers all the time. Our currently certified people and other people are like, okay, you're rattling off of these numbers. But our administrative code, one of them is 580-9-44 and 580-2-20, and that's for our treatment providers. If you're wanting to do prevention, then it is 580-9-47. And again, this Becoming a Community Provider is for SU prevention and treatment providers. So just know we do offer those a couple of times a year. And that's all I have right now.
Okay, thank you, Beth. Mark?
Yes. So basically, what this is saying, the provider approval information for recovery support agencies, there's an approval process through the Department of Peer Programs at the Alabama Department of Mental Health. If awarded, new agencies will be contacted by the Director of Peer Programs to start the approval process. So my name is Mark Lippon. I'm the Substance Use peer coordinator for the Alabama Department of Mental Health over the Certified Recovery Support Specialist certification under our Office of Peer Programs. If you are providing recovery support services and you're an agency providing recovery supportive services, your peer specialist providing those services will have to eventually become a certified recovery support specialist certified by the Alabama Department of Mental Health. There's an application process and there's requirements to become a certified recovery support specialist. And I'm going to put my email in the chat, and feel free to contact me for any of that information. Thank you.
Thank you, Mark. Thank you, Beth. All right, so that covers the certification and the approval process. Let's talk real quickly about supplanting. This was one of those areas that we had some conversation about last time, and I just we just need to probably make sure that everybody understands what this is, and we're going to spend just a minute on this. So if you have services currently that you are providing for which you are already receiving designated funds, for which you are already receiving by way of contract, whether it's state, federal, or other opioid settlement funds, you may not then use these funds as a means of supporting that too. Applicants have to have a plan in place to ensure that there's sustainability beyond this first year, and that was true in the last round as well, because there's never going to be a guaranteed. So you're going to have to be able to demonstrate that you're not supplanting any existing funding, and you're going to have to avoid using any of these dollars in areas where those other funds are available or existing. For example, like with Medicaid or some other insurance programs. Those should be used as the payment source for treatment wherever possible. So this is not adding on funding to current things you're already being funded for, currently already in existence. So that includes people who are already under contract with us, or have other programs or receiving other funding sources that support the current ongoing use of those programs and services you're providing. So we need to you're going to have to, this kind of came a little bit off the slide, but we are going to ask that this is again in the RFP, a statement of intent is required, meaning you're going to have to put in that proposal somewhere that says you will not use these funds to supplant or to supplant services and funding you've already received. So make sure that statement is in there. You are certifying that those funds, the funds from this award, if you were awarded those funds, will not be used to supplant any expenditures from any of these other funding sources. And I want to just pause for a minute and let the other directors comment, and Brooke, if you guys have additional information you'd like to throw in there to clarify. This can be a touchy subject, so I wanted to make sure we spent time just to really reiterate that.
Debbie, thank you for bringing it up, and I will add to it. Sometimes you want to introduce a program to your treatment, your current treatment program, and that's fine. The only problem that we will have on our end is if you're stating that you're already currently providing particular services, and I use trauma-informed care for an example. Trauma-informed care is something that needs to be provided to your clients based off of the treatment plan, but you may decide that you wanted to introduce something a little bit more extensive. If by any chance you plan on using funds to introduce a new program, it must be written in detail, and your schedule of current services must reflect when and where you're going to be offering that new particular class. So I wanted to put that out there because I think from the last RFP, that's one of the things that I kind of ran into. But that agency did an excellent demonstration of when those courses were going to be taking place, that it was outside of their original schedule. It was being provided by a different treatment provider. And so they were able to show that they were not supplanting services that they were already providing at the agency. So that's all I got, Deb. Thanks.
Thank you. And she made a good point too. And that is one of the things that in the review process, because we are using the typical RFP process for, I believe the withdrawal management and prevention, they're going to follow their same, the treatment, and recovery support RFP. We will be using a review panel again, just as we did last time. And those did raise some flags, and we are doing some things internally to give those reviewers information on the services that are already being funded and provided when we do this round, just so that everybody knows that there's no secrets there. And we do bring in outside subject matter experts and people who work as part of the Opioid Council to help with that part. But Denise made a great point. It will raise flags if it's currently things you're doing. So spend some time really outlining that for us in your RFPs. Thank you, Denise. Okay, let's move along. I'm going to call up each of the directors to address these next two slides for me. As I mentioned earlier, we needed to spend just a little time to make sure everybody knew what category it is you are selecting to apply for. The last round, we did have some confusion, people struggling again with, is this recovery support or is this prevention? So we actually want to just take some time to clarify these categories so that you know full well in advance the category to which you might want to apply, and help you in the process of selecting the one that's most appropriate. So Brandon, we'll start with you, please.
Sure thing. So with this RFP, the purpose is to provide primary prevention services. So the Center for Substance Abuse Prevention recognizes 6 intervention approaches that can be utilized with the population of focus. And so those are listed on the slide that you see. And so those are the 6 CSAP strategies that if you intend on applying for this particular RFP, you would have to address these any of these 6 particular strategies. And so those are the definitions or explanation of each of the 6. And for additional examples or activities of what would apply as a information dissemination strategy, for instance, you can refer to the prevention standards, and those examples are provided there.
Thank you.
You're welcome.
Denise, would you cover that one for me? For the treatment services?
Yeah. Do you want me to read this or just paraphrase? I'll
You
read
can
it.
just paraphrase it. What are
Yeah,
treatment services?
I'll go ahead and read it just so that I don't miss anything. But treatment services refer to a broad range of resources, amenities, and solutions provided by qualified professionals to individuals with substance use disorder. Treatment services can include identification, intervention, assessment, diagnosis, counseling, family services, social services, case management services, and continuing or follow-up services for individuals with SUD. The overall goal of treatment is to reduce or eliminate the problematic use of alcohol and or drugs as a contributing factor to physical, psychological, and social dysfunctional, and to impede and or reverse the progression of any associated problems. The treatment process is comprehensive and addresses the multiple and complex needs of individuals and their families impacted by substance use. The treatment delivery process assures that all necessary and available services are delivered to address individuals' needs related to substance use. Treatment proposals should follow the ASAM criteria model. And I will add here, currently we are still working up under ASAM Edition 3. So I know a lot of individuals have been introduced to ASAM Edition 4. We are not currently using that model. Excuse me. And we probably will not begin using that model until FY26. So just to clarify, anything that you write in your proposal should be related to Edition 3.
Thank you. And she is the director for substance use treatment services, so she will be ultimately overseeing all of those programs that are awarded, obviously. So that's just a description. All of that captures treatment, and that's what's falling in the treatment and recovery proposal. The withdrawal management, she has already described it. Denise, I'll certainly, if you want to comment further on that one, you can in terms of what that service might look like. You're welcome to jump in on that too at this point. It's pretty self-explanatory, but
Yeah, and the best way to understand withdrawal management here in Alabama, we are doing the 3.7. So your RFP should follow the 3.7 guidelines. If you want to go in our administrative code just to see what that looks like, then by all means do so. But of course, the RFP, and it's really going to all depend on how you write out your budget. But just keep in mind, and that is the reason why it's $1 million for one agency, because out of the 3 proposals, this particular service must have a medical doctor on staff, and then all of the other amenities that come with withdrawal management. So again, the best way for you to get a full understanding of what we're looking for is to go to our administrative code on our website and look at everything that encompasses that falls up under the 3.7, not 3.7D, 3.7. That is exact. That's what you'll be looking for, and that's what you'll be graded on.
thank you.
You're welcome.
All right, Mark, if you will describe what recovery support services look like for me, please, under this category.
Yes. So what do recovery support services look like? Well, recovery is the process of gaining control over one's life and the direction one wants that life to go. On the other side of substance use disorder and all of the losses usually associated with it. Recovery supportive services are non-clinical services that assist individuals and families to recover from substance use disorder. They include social support, linkage to and coordination among allied service providers, peer services, and a full range of human services that facilitate recovery and wellness, contributing to an improved quality of life. These services can be flexibly staged and may be provided prior to, during, and after treatment. Recovery support services may be provided in conjunction with treatment and as separate and distinct services to individuals and families who desire and need them. Professionals, faith-based and community-based groups, and other recovery support service providers are key components of recovery-oriented systems of care. Yes.
Okay.
Thank you.
Thank you, Mark. So that gives you a summary of all of the categories that are available, so that you hopefully will be able to not have any questions or have any issues in selecting the category for which you'd like to apply. All right.
And Debbie, I made an error. I did make an error. I do need to go
Right.
back and apologize. It is not 3.7. I did change it. And I was like, when I was saying that, I was like, wait a minute, I think I changed it. It is 3.7D. So when you're looking at administrative code, but both of them pretty much carry the same criteria, but it's 3.7D. Thank you.
Thank you. Appreciate you clarifying that. All those numbers run together in my brain after a while too. So appreciate it. Okay. Next steps. Let's go ahead and move forward with that. So follow the application precisely. Failure to do so will result in the process and the proposal being eliminated. In other words, if you get the order of pages all mixed up and number of pages or the placement of pages and number of copies, if, last year we had a couple of kind of unfortunate situations where someone just said a copy of their proposal. The guidelines are very clear as to how you need to submit that, right? Identifying information, cover sheets that are required, budget requirements, clearly indicating the category for which you are applying. That's why we took the last 3 slides to really nail that down for you guys. So make sure that you are clearly stating that on your application. Review all of the links and the related resources. We want to make all of this available to you, of course. That's the reason why we did this way this time, to make sure that you've got all that information you need. Prioritize the requirements for certification, the E-Verify and STARS enrollments, and Theo is on the call too to help us navigate some of that. The tax and business registration and identification requirements, including any kind of related time limits and insurance requirements. So make sure all of that is there. I'm not going to spend a lot of time right now about scoring, but basically there is scoring criteria for new proposals. There's a scoring criteria for continuation proposals. There's scoring criteria for prevention and the withdrawal management. So all of those are separate criteria, and you'll need to look at each of those proposals and how they are different relative to the proposal you are submitting. So the usual process will be followed, again, for prevention and withdrawal management. The treatment and recovery support will go through the review process I described for you a little bit earlier. Let me go ahead and hit this and you'll hear it again. The RFPs beyond today, and actually since publication, all questions forward, all of your questions or calls need to be forwarded to Leola Rogers in contracts. For every question that we don't have an answer to today, you will have an opportunity to submit your questions in that question period and in that process. And it is through that process that there will be an answer provided to every question submitted. Okay, so if we don't have the answer for you today, just know that going forward is the process. You must submit your questions by August the 9th, 12 noon sharp. So we're going, it's 12 sharp. Unfortunately, we have had in the past situations where people have tried to hand deliver or thinking the mail would get here in time. If it's not in our office by the deadlines stated in the RFPs, they will not be accepted. And that is across the board without exception. So all the answers to any of your questions that we don't get answers to today will be posted August 15th. Okay. So here is the process for new providers. And as I mentioned, Theo is on the call. Theo, do you mind? Are you where you can hear me?
Yeah, yes.
Yes. So do you want to comment to any of this, or you want to kind of walk through this slide with them? Obviously it's pretty cut and dry, but I wanted to put this up there. This is the information that is needed for new providers getting started, correct?
Yeah, that's pretty much for a new provider. Our current existing providers already have all that information is in place. And also in the RFP, like the first part of it, you see it in the RFP is already in there that if contracted with they'll need to have that, the business needs to be registered with the Secretary of State office. If you're domestic or foreign, as it says, foreign means out of state, and domestic would be instead providers. And the other requirement is the E-Verify. That's for the employment with the DHS, Department of Homeland Security of that. And the next part is the STARS. That's for us to even make any transactions with the provider, you have to be registered in STARS. And also you must submit your tax ID to ADMH. If you're a new provider, we need that for our records, and that needs to match with every information that was submitted to the Secretary of State for the business registration. Another important thing we need is a certificate of insurance. That's a copy of your liability insurance. They'll need that. That's all I have.
All right. Thank you, Theo. Appreciate you walking through that. So these are kind of the big things for those of you who are new providers in terms of priorities to address. And this, if you start this before an announcement of awards are made, that's fine. But doing these things does not guarantee award. You obviously want to wait and get, make those decisions relative to who is actually funded. But we hope to have that award. In fact, let me just go onto this next page because some of this is outlined there for you. Whoops. Getting ahead of myself. The release date was July 24th. Deadline to submit questions, as I mentioned earlier, is August 9th by 12 noon. The answers to your questions will be posted by August 15th, and then the proposals are due. It's in bright red for you there. 2 p.m. sharp Central Time, September the 23rd, 2024. And you'll want to review in each proposal. There are guidelines there for mailing. The selection process will then take place. The review process, the scoring process will happen from September 23rd until sometime near the 1st or 2nd of October, first or second week in October. And we hope then that the notification selection will be made end of October. That's an approximate date, as you will see on the RFPs. But that's what we are shooting for right now. It all kind of depends on obviously how long it takes to get everything reviewed and centralized, and those decisions made about the funding, and looking at the numbers and how all that pulls the money down. Just like last time, we want to use every dime that's been allocated. So that's part of what we have to look at sometimes. But your requests are up to those funding limits. Let me stress that again, okay? And then for those awarded, the start date again is the date on the award letter, should you be one of those who is a recipient or awarded part of these funds, okay? Quickly, all right, here are important links for you to use as resources. That obviously is our ADMH website. There is information there on how to become a community service provider. That's the link that Beth referenced earlier, and then also the strategic prevention strategies that Brandon spoke to. Those are listed there for you as well. Okay. We want to move into just a time of discussion or questions rather. I'm going to ask, if you will, just for sake of respect, that you raise your hand, and then we will try to address your questions if you have any. If not, that means that we did a really good job of clarifying a lot of information that's awfully complicated in a very short amount of time. But I want to, first of all, extend a note of appreciation to the directors and your willingness and all to participate and to help mitigate this process. All right. Mari Long, I see your hand.
Thanks, and good afternoon to you, ma'am. Quick question. So I've started the process last year of becoming a provider. And I know it told me it ended I had to do going through the process, I had until September of this year. So in starting this, would I need to start the process over for the entirety if I'm applying for this RFP to get everything squared away, or how would that work?
I'm going to ask Theo and Beth to address that for you, please.
Hi, Maury. If you haven't made application and your phase 2 orientation expires in September, then yes, you will have to go through the process again for phase 1 and phase 2.
Gotcha. Thanks.
Yeah, just so everybody knows, you get a certificate after completion of the live webinar, and that certificate that you receive is only good for a year, and you have to make application prior to the expiration of that certificate for completing the phase 2 live webinar.
Thank you, Beth. Thea, did you have anything else to add to that? I think Mari, you were talking specific to certification as a new provider, correct?
Correct.
Okay.
And I guess, and tying that into the RFP process with this one, I guess, applying, I guess the two timelines, are they totally separate? Start all over again? I know it said you got into a certain 4 months after approval to be everything squared away. So I guess
Correct.
have to do that. Yeah.
Correct. Well, what Beth can probably speak to is there will be an opportunity for you to participate in that training. There will be plenty of time for you to go through that process again. But yes, that everyone who is not a current provider has 4 months to achieve either the approval with Recovery Support Services or as a certified, Alabama certified treatment provider from the date of the award on the date of the award letter.
Okay, thank you.
You're welcome. Ms. Jackson, I see your hand.
Good afternoon, and thank you very much for this conference and providing this information. I just wanted to get some clarification on the continuation, or what is meant by continuation. So if or two scenarios. The first scenario is if we received funding in the last cycle, we're putting our program together, but we're still waiting on some elements, both on our part and on the state's part. And we'd like to make sure that we have continuation funding. Would that apply as a continuation, or would that be considered supplanting? Part two is if we were to submit a proposal for another treatment and recovery program, totally separately from what we're doing as a part of the first round of funding we received, would that be considered a continuation, or would it be considered a new application? And the same occurred is if we were to pursue a prevention funding, even though we received funding last round, would that be considered a continuation or a separate funding?
Sounds like like you have three issues there. If you are presenting a proposal for a new separate program in a different category, that's a whole different application. If it's a continuation funding, then you have to be able to substantiate questions and answers to the evaluations that were part of the first funding round. You would have to be able to demonstrate that. If it was a treatment and recovery support award you received, that information is going to be, there's actually a section under section 4 in the proposal. If you look at that continuation award, that's what would explain. You have to be able to provide a proposed 12-month budget narrative. There's several things there specific to the budget, but the continuation award speaks specifically to continuing services, but it's not it's not to basically go in and lay over what you were awarded the first time. It's to continue that service beyond. You have to be able to substantiate some pretty strong objective measures, outcome measures, to show that what we funded to begin with is working.
Okay.
Okay.
Okay. Just wanted that clarification, because you know, again, since it's continuation, I didn't think it would be supplanting, but I did not. I'm learning that some folks will interpret that slightly different, and I want to make sure that we were not doing anything against ADMH's interpretation. So thank you so much.
You're very welcome. It's a good question. Thank you. Kendra McDowell? We can't hear you, Kendra. Hey, Kendra.
I think y'all have already spoke to this, but I just wanted to clarify. If we have several programs under our umbrella, so we have one that serves pregnant women, we have one that serves adolescent kids, we have one that serves adult parents with children, can we apply in each of those categories? You know what I mean? Because we're serving different populations in different places.
The answer to that is yes, you can submit different proposals for different programs. You just can't be at the same location doing the same program, same service to the same population. So
okay, I just wanted to clarify.
Right. Some will create a proposal that maybe does, gosh, my idea bank is kind of dry right now, but maybe you're wanting to do services to adolescents and their families. Maybe you're wanting to do, you know, a detox or withdrawal management MOUD program or something like that in a different. So you can have, even though you might be perfect town treatment center, it's, you know, you can submit multiple proposals as long as it doesn't overlap the same program, same services, same population, same location. And
okay,
again,
thank you.
You're welcome. Let me open it up too for any of the directors that want to speak to that, please. Okay. Let's see. Thank you, Kendra. Good to see you. Yvonne, I think I saw your hand up next. Okay, for sake of time, I'll come back to you. Julie Ray. You need to unmute yourself, please.
Thank you. Okay, I know, and I just think you just answered my question, but I directly want to ask it because I learned that way. But when you said that you can apply for multiple project. And so I can apply for as many as I want as long as they don't cross over each other and go into,
Yes,
and then
correct.
on the grant that we got with the other money, all I do is a continuation and write another proposal.
Right, and you would follow the guidelines for a continuation funding proposal for those that you may have been previously awarded.
Continuation. Say that one more time.
It's in the RFP. There's wording there in the treatment and recovery support. Follows section 4 on the RFP for the treatment and recovery support RFP. All there are outlined for continuation funding proposals.
Thank you so much.
You're welcome. There's several.
This helps us so much.
Good. Yvonne, I'll come back to you one more time.
Thank you.
You're welcome, Julie. Thank you. Okay, I see ready staff. I don't have the name, but I see a ready staff. There you go. Go ahead.
Hi guys, it's Nicole Shine. I had a question for the prevention RFP. I heard two things. So at first you said $75,000 per agency, but then later on in the PowerPoint it says $75,000 per award. So just for example, if we apply for just throwing out counties, Tuscaloosa, Bibb Hill, Choctaw, Pickens, and we want to do prevention in all of those counties, is it $75 for all of them combined, or is it $75,000 per county?
Per agency. So the agency would only receive $75,000. So if you wanted to address all of those counties, it would be $75,000, and then you disperse those amongst the counties, or you can address one county for $75,000. $75,000 per agency.
Got you. Thank you, Brandon.
You're welcome.
Thanks, Brandon.
I think I'm unmuted now.
Okay. Hi,
Yeah. Hey, I just wanted a quick question, or maybe it's a long question. We are located in a church in one large room, and we do groups in another room. We were planning on going upstairs to the counseling center upstairs, but we need to do some minor repairs. Could the repairs go on the grant on the RFP?
Are you currently are you requesting for a recovery support or prevention, or?
We're recovery support, and this will be a continuation grant.
Okay, so you couldn't fund the same program serving the same population at the same location. If you have repairs to do, I don't believe that's going to follow under that. I don't know if Nick or Mark want to speak to that, but this does not cover any capital gains. So anything that you're doing as far as building a new building, making a new space, those kinds of things are not covered under this RFP.
Okay.
So it sounds like that may not be the scope that we'd want to follow. If you do a continuation award, you could do it to continue to serve, other populations using the same model, or to continue what you've already done, as long as you've established the outcomes that are listed in the RFP.
Okay, so I'm probably beating a dead horse and probably just want to hear what I want to hear, but I'm gonna rephrase this thing.
Yeah, no capital gain.
Okay, so this church is really big, right? So we have different rooms, and it's crazy because our heating system and cooling systems, we got about like 10 of those, right? So in one space that we have per group, that heating system has went out, but the other space that we have for socialization, that unit is working. So when we say capital fund, that'll be capital funding, although it's in another.
This would be for services that we're wanting to provide.
Okay.
Like
okay.
This is not so much to make repairs and that sort of thing.
Okay.
I mean,
And I echo what Debbie said as well. Yes.
Mm-hmm.
Anything else there, Mark, you want to throw in on that? I know you've been working with this particular award already.
Just really everything that you said, it has to be for services provided. And for services delivered and no capital gains or anything like that.
Okay,
Thank you. Chris Ratana.
thank you.
You're welcome, Yvonne. Thank you.
Hey, guys.
Okay.
This is a budget question. So the awards are 12 months awards, and folks are supposed to start within 120 days after getting the award, which means that you're going to have maybe 6 or 7 months worth of time to operate. But it's a 12-month grant, right? And the proposal says these funds end September 30. So I just want to confirm that what would happen is that if you expended 7 months worth of funds from these 12-month grants, that you can count on the remaining 5 months being in your next grant.
My
or next-
understanding, right? I think the distribution. My understanding is we are able to roll those over. I am not. That's one of those things I'm going to ask you to actually put in a question for Leola to clarify, if you don't mind. My understanding is we can, any unused funds get rolled over or can roll over into following years, but
And a related question, we talked about the continuation funds, and I've looked briefly, and it looks like we're supposed to be able to demonstrate that we've achieved some objectives, but the funds just have started, so we don't have time. You know, by the time we've gotten these programs, staff hired and programs open, we're not going to have much results to be able to then demonstrate in a continuation grant. Can you speak to that, please?
my only response is some have been able to, some haven't. It just kind of depends on how quickly some things were put in motion. And of course, that has everything to do sometimes with the description of the program and how close it was to already being implemented or how it was enhanced or changed. Some have, some haven't, but that is part of the continuation requirement, is being able to demonstrate that there are some outcomes measurable. How long it is, there's not anything specific to say you have to have 6 months or 8 months or a year's worth of data, but something to substantiate that this is working. You are seeing benefit, you are seeing good outcomes there, you are tracking and responding to the evaluation questions, or have answer those questions. And then that would be one that would be considered for that type of funding stream.
Okay, I guess maybe related to this, for the current year's funding, should we assume as well that if we're only, because some of us got new buildings, new staff, that type of thing, which takes longer, which means that in our case, we're not going to start services until this month. Should we assume that that's a 12-month funding as well, and that the previous years would be able to carry forward of unexpended funds will be carried forward to the next contract year?
I would suspect so. Denise may be able to speak to that specific to individual contracts, but it would depend, I guess, on how that contract was set up when you guys officiated that at the time.
Say that one more time, Chris.
Well, when we started a new service in a new area where we had to rent new space and that type of thing, we had 120 days to get it open. So we're just now opening, it's August. So we'll have 2 months worth of services, but we had a 12-month allocation. I just want to confirm that the balance of our funds that we were allocated will be rolled over into next year's contract.
Yeah, like Debbie said, I don't see where that's going to be an issue. I will confirm with Nicole, but that was my understanding, that it would roll over to next year.
Yeah, the funds that were unused from that first round earlier this year. Yes,
right.
I do know that from that RFP there is that continuation for sure.
Let me
clear that word. There's that ability to use beyond this first year, to have those funds available to you beyond the first year.
Good. Okay. Thanks so much.
Thanks, Denise. Appreciate you chiming in on that. Jocelyn Edmonds. Did you have a question? Okay.
Yes, ma'am. Okay. Am I on here?
You are?
You are? Okay. We have built a 25-bed facility, the Place of Grace, and the walls are up, the building's built. We've just got to finish the inside of it. Can we?
You cannot use the fund for capital gains, right? You're on your building, that sort of thing. If you're rental, renting transportation services, those kinds of things were allowed, but it's not for renovation, completion, building, purchase of buildings and
Okay.
vehicles.
Thank you.
Thank you. Okay, we are at the top of the hour. I'm still seeing a couple of hands up, but I think it's from people who have had previous questions. So let's use this time just to clear all minds. Anything else hanging out there quickly? All right, well, we are going to wrap this up. Again, please keep in mind, if you have questions beyond today, there is a question process. Submit those, and all that information is for you there in the RFP on how to access the place where you are to submit those questions to Leela Rogers, and the deadlines related to that. So make use of that. Every question that's put out there will be answered. We really appreciate you guys taking the time to join us today and are very excited about this opportunity. We don't get too many chances like this in the life of treatment services across our nation or our state. So we got to make it right this time. And we definitely want to make good use of these funds and make sure that we are doing what's necessary and important for our people to survive and get the treatment and help they need. Thanks to everybody who joined the call. Thank you to my directors who are here to back me up and help me out with this. And you guys have a great day. We look forward to seeing y'all soon. Take care.
Good job, Debbie. Thanks.
Thanks, Denise. Appreciate y'all.